What if you could fight one of the most terrifying diseases on the planet? Not with some billion-dollar wonder drug, but with a cheap, common dog dewormer. Yeah, it sounds like something out of a movie, but it's a real story that's unfolding right now. Today, we're diving into how old, forgotten drugs are getting a second chance in the controversial fight against cancer. All right, let's get right into it. First, we're going to look at a pretty strange new cancer trend that has doctors talking. Then, we'll get into an absolutely incredible story of an accidental discovery, break down the actual science, hear from real people, and finally, we'll ask the big question: is this the start of something huge in cancer care?
So, to really get why people are even looking for these alternative options, you have to understand a new and, frankly, pretty terrifying problem. Since about 2022, some doctors have been seeing something they just can't explain.
So, what are we talking about? You might have seen this term online, turbo cancer. Now, I want to be clear. This isn't an official medical diagnosis. Not yet, anyway. It's what some frontline clinicians are calling these new cancers that are behaving in ways that leave even the most experienced oncologists totally stunned. Here's Dr. William Mawkes, a physician who's trained in oncology. He's describing seeing young people with zero family history, no genetic red flags, who are suddenly showing up with stage 4 cancer that is just unbelievably aggressive and fast. So here's a breakdown of what makes these so different. They grow incredibly fast, and they show up late, already at stage 3 or 4. And they're often totally resistant to the usual treatments like chemo. But maybe the most shocking thing? Experienced oncologists who are usually spot on with their predictions are finding their prognoses are off by a factor of 5, sometimes even 10. A patient they think has 5 years might only have a few months. It's a whole new ballgame. So, faced with this grim new reality, where did a potential answer come from? Well, it didn't come from a billion-dollar research lab. It came from a casual conversation about medicine for dogs. Okay, let me introduce you to Joe Tippins. In 2016, he was diagnosed with terminal stage 4 lung cancer. Doctors gave him a survival rate of less than 1%. He was basically told to go home and get his affairs in order. He had run out of options. And then he gets a call from a friend of his who's a veterinarian. And this vet tells him about a totally bizarre discovery in a lab. A simple anti-parasite drug for dogs, fenbendazole, seemed to be fighting cancer in mice. With literally nothing to lose, Joe thought, why not? So he tried it. He took the dog medicine. And the result? It was absolutely staggering. His stage 4 terminal cancer completely vanished. And this wasn't temporary. Years later, he's still here, totally cancer-free. An outcome that, for his diagnosis, is just medically unheard of. Joe's story is just wow. It's almost unbelievable, and it makes you ask the obvious question. How is that even possible? How could a cheap anti-parasite drug have any effect on something as complex and monstrous as cancer? Well, the answer is in this idea called drug repurposing. You're basically teaching old dogs new tricks. We're talking about drugs that have been around for decades, they're known to be safe, they cost pennies to make, and now scientists are discovering they have these incredible, unexpected anti-cancer abilities. Now, what's so wild is that these drugs don't just do one thing. They're not a sniper rifle, they're more like a shotgun. They attack cancer from a bunch of different angles all at once. They literally starve cancer cells of their fuel. They can make chemo start working again, even when it had stopped. They stop tumors from building new blood vessels to grow and spread. And this is the big one. They seem to target the cancer stem cells, the deep-rooted mother cells that are often the reason cancer comes roaring back. Look, Joe Tippins' story is amazing, but one story is just a story. For this to be real, you need more than that. And now we're starting to see this move beyond just anecdotes and into documented medical cases. And this is a huge one. We're talking about researchers at Stanford University publishing a paper on 3 different patients. All of them had terminal stage 4 cancer. All of them had failed chemotherapy. And all 3 went to complete remission after using fenbendazole. That's a big deal. And it's not just happening in academic papers. Dr. Mawkes says he's seeing these incredible results firsthand with the patients he advises. He's talking about people with things like stage 4 pancreatic cancer, which is almost always a death sentence, being declared cancer-free. Okay, so all of this evidence, from personal stories to doctors' accounts, it all leads to the next big question. How are people actually doing this? What do these protocols even look like?
Now, hold on. Before we go any further, I have to be absolutely crystal clear. This is not, and I repeat, not medical advice. What we're about to show you is for informational purposes only. It's based on what physicians like Dr. Makis have observed patients doing. All right, so based on Dr. Makis's work, here's a look at some of the protocols patients are using. For ivermectin, it's typically a daily dose that depends on your body weight. For fenbendazole, or mebendazole, which is the human version, a common approach is about 1,000 milligrams a day, taken 6 days on, 1 day off. It is interesting to note that the Stanford study we mentioned used a different cycle, 3 days on, then 4 days off. And I'm going to say it one more time because it's that important. This stuff is complex. Trying to treat yourself is unbelievably risky. Please, always, always work with a qualified doctor or medical professional before ever considering any kind of new treatment. So let's recap. We've got this new problem with turbocancers. We've got these incredible stories. We've got a growing pile of science and case studies. You'd think the entire medical world would be jumping up and down, right? Well, the reality is a lot more complicated. On the one hand, you have this culture of fear. Dr. Maki says that a lot of oncologists will actually threaten to fire their patients if they even bring these drugs up. But on the other hand, something really interesting is happening. See, a big part of the problem is money. These drugs are old and cheap, so there's no big pharma company that's going to spend billions on clinical trials. But some governments are starting to wake up and see the potential. And this right here is proof. This is an official announcement from the Florida Cancer Innovation Fund. They have literally created a brand new grant category specifically for generic drug repurposing research, and they even call out drugs like ivermectin. This is a massive step. It's official validation and millions in funding for exactly this kind of research. So we're at this incredible moment in time. You have this grassroots movement led by patients, fueled by these amazing stories and emerging science, and it's smashing right up against the established medical system. But at the exact same time, governments are starting to legitimize the very thing these patients have been fighting for. The question is, what happens next? Because it could change everything we thought we knew about how to fight cancer.